Hello and welcome to Spotlight on Wawarsing. I'm your host, Lauren, and today's topic is suicide prevention. Joining me today is Sarah Burns from the Institute for Family Health. Thanks for joining us today.
Thanks for having me. I'm excited to be here.
Before we dive into our main topic, can you tell me a little bit about the Institute for Family Health?
Absolutely. So the Institute for Family Health is the largest network of federally qualified health centers in New York State. We see about 100,000 patients per year, and we have about 30 locations in New York City and in the Mid-Hudson Valley. We offer primary care medical services. We also have behavioral health services and dental. And we also offer a range of special programs and social work services to serve as a wraparound to the healthcare services. In my role there, I'm the Director of Suicide Prevention. This is a relatively new position. Most healthcare organizations don't focus very much on suicide prevention, and they don't have a position like this. But the Institute has decided that it's an issue that all healthcare organizations should really be focusing on. So it really shows the organization's commitment to keeping all of our patients safe, alive, and hopeful for the future that they hired a director of suicide prevention. So I oversee all of our training, research, and policy activities related to suicide prevention.
How do you know if someone's thinking about suicide?
That's a great question. I'm really glad you asked. The best way to know if somebody is thinking about suicide is to ask them, flat out. So go with your gut instincts. If you're concerned about somebody, there's usually a reason that you're concerned. Some of the warning signs that you might want to look out for to know if somebody might be thinking about suicide, to let you know that you need to ask the question, is talking about feeling hopeless or having no reason to live, or talking about feeling trapped or being in unbearable pain, or talking about being a burden to others or feeling like you're a burden. Other things to look out for are increased use of alcohol and drugs, acting agitated or more anxious than usual, or behaving recklessly. Also, sort of any change in usual behavior for the person, like sleeping too little or sleeping too much compared to what's normal. And finally, a major warning sign is withdrawing or isolating from others.
So is it okay to ask if someone's thinking about suicide?
Absolutely. Asking about suicide doesn't give someone the idea to attempt suicide. And actually, asking directly about suicide indicates that you care about them, that you're willing to listen, and that you're a safe person to come to. But how you ask about suicide really does matter. So when you're asking somebody if they're thinking about killing themselves, you need to be non-judgmental and ready to hear their answer, whatever it is. So let me give you a few examples. A bad example, saying it like, "You aren't thinking of doing something stupid like killing yourself, are you?" really tells the person the answer that you're looking for with the way that you ask the question, and doesn't really give them a chance to be honest or feel like you'll help them if the answer does happen to be yes. So in contrast, what you might say instead is something like, "I've noticed that you don't seem to be yourself lately. You aren't doing the things you used to be interested in, and you've been fighting a lot with your family members." Sometimes people experiencing similar situations to what you're going through think about ending their own lives as a way to escape the pain. Have you been thinking about killing yourself? So if you noticed, I asked the question directly, and I told the person what it was that I was concerned about, that I'd seen them, change.
Right.
So the second example, of course, is just much more welcoming.
What should you do if they say yes?
So this is the scary part. This is the scary part about asking that question, right? You have to be ready to deal with if they do say yes.
Yeah.
So if someone tells you that they're thinking about suicide, the first thing is to always take them seriously. Be direct. Talk openly and matter-of-factly about suicide. Be willing to listen. Allow them to express their feelings and accept what they're really telling you. Like I said before, be non-judgmental. Don't debate whether suicide is right or wrong, or whether their feelings are good or bad. And don't lecture on the value of life. That's not going to be helpful for them in that moment. Get involved. Make yourself available. Be supportive and willing to listen and connect them to help. Obviously, don't dare him or her to do it. Don't act shocked at what somebody tells you. That'll put distance between you and the other person, which is the opposite of what you want to be doing at a time like that. And don't be sworn to secrecy. Don't promise that you won't tell anyone or that you'll keep it a secret. It's really important to get help for people who are thinking about killing themselves. You can offer hope that alternatives are available, but don't just offer reassurance blindly. You can't promise somebody that things will get better, but you can commit to working with them to try to make things better. So there's a little difference there. And take action. Don't bear this burden alone when you know that somebody might kill themselves. Get help from a teacher or an adult or a mental health professional. We'll talk about resources in a little bit. There are people and agencies that specialize in crisis intervention, and they're available 24/7 to help.
Now, I know you mentioned something about not keeping it private, but what if you think the person is just having those suicidal thoughts and they won't actually go through with it?
Mm-hmm. The scary part is there's no real way to know that suicidal thoughts come and go, and the intensity of those thoughts come and go. So people who are thinking about suicide can really benefit from treatment and from learning ways to manage those suicidal thoughts. So it's really important to make sure that a loved one that's thinking about suicide gets the help that they need.
If someone's having those thoughts, do they have to go to the hospital?
Not necessarily. A good mental health professional or crisis worker will work with the person and their friends or family members, the supportive people in their life, to help them and provide assistance in the least restrictive setting possible. So a mental health professional or crisis worker will help the person create a treatment plan that keeps them safe and provides hope and focuses on creating a future. So some people who are suicidal do need to go to the hospital, but a lot don't and can remain in the community and receive treatment on an outpatient basis.
What are the kinds of different resources that are used for suicide or different things?
Yeah, really important question to make sure that the people watching know what to recognize and what to do if they're worried about someone, but also where to get help. So of course, my organization, the Institute for Family Health, is a wonderful resource here in the community. We have several locations here in the Mid-Hudson Valley. And like I mentioned, we have primary care, mental health, dental, and social work services for patients of all ages. If you'd like to access mental health services, you can call the Institute for Family Health Center for Counseling at Kingston. And the number is 845-338-2562. And I'd also like to tell you about a couple great suicide prevention specific resources. If you're thinking about suicide, worried about a friend or loved one, or would like emotional support, the National Suicide Prevention Lifeline Network is available 24/7 across the United States. And the number for the National Suicide Prevention Lifeline is 1-800-273-TALK. That's 1-800-273-8255. This National Suicide Prevention Lifeline also has online crisis chat. If the person you're worried about or you don't feel comfortable talking on the phone, so you can connect to crisis chat online at suicidepreventionlifeline.org. And finally, if you would rather text, you can connect with the crisis text line by texting HELLO to 741-741.
What happens when you call the lifelines?
I'm really glad you asked, because it can be really intimidating to ask for help and to reach out. So let me give you an idea of what to expect. First, you'll hear an automated message that offers additional options to check, while you're being connected to your local Lifeline Crisis Center. So there's options for English and Spanish, and there's also an option to be connected to the Veterans Crisis Line, whose crisis counselors are specifically trained in assisting active duty military and veterans. So then you might hear a little music while you're being connected, your calls being routed to the nearest crisis center. And then a trained crisis worker will answer the call. that person sort of will listen, understand your problem and how it's affecting you or your loved one if you're calling about somebody else. So yes, you can call about somebody else and receive support on the Lifeline, and get you the help you need. They can connect to resources, provide additional supports, and even follow-up phone calls to check back in and see how you or your loved one is doing.
Do people actually recover from suicide?
Mm-hmm. Absolutely. People with mental health problems, people who've thought about suicide or even attempted suicide can get better. Treatment and recovery are ongoing processes that happen over time. To see real people who've attempted suicide and gone on living, you can visit livethroughthis.org. Live Through This was created by Desiree Stage, a photographer, writer, and suicide attempt survivor. The Live Through This project aims to counter the silence and shame surrounding suicide by encouraging survivors to own their experiences publicly, using their full names and likenesses. So livethroughthis.org contains the portraits and stories of people who've attempted suicide and gone on living, providing proof that recovery is possible.
Are there any other questions or anything you want to inform us about suicide prevention?
I think I would just really like everyone listening to know that suicide can be prevented. Perhaps not every single death by suicide, but coming together as communities, as professionals, as family members, loved ones, that this is a public health problem that is preventable, that if we come together, we can do something to prevent it.
Well, thank you for joining us on this episode of Spotlight on Wawarsing. I'm your host, Lauren, and thank you, Sarah, so much. See you next time.
Thanks for having me.